Now, the early winter holiday shutdown is an attempt to curtail rising COVID infections, with a highly transmissible Delta variant now upping the risk. At the same time, the break will allow teachers to get vaccinated, as Lee explained, and also have a level of immunity by the time school resumes, which is scheduled for the 19th of July, barring any further lockdown decisions. Let's discuss the education plan with Cynthia Barnes, the General Secretary of the National Teachers Union. Thank you so much, Ms. Barnes, for joining us. Now, to support the decision to start these school holidays early and then come back on the 19th.
Good afternoon, Sally, and to the viewers at home. We, as the National Teachers Union, we really applaud the pronouncement of the Department of Health, where they are saying the closure of schools, because this will protect the learners as well as the teachers and the community from being infected further, and then they had to be at home for this recess so that they are not infected with this Delta variant, which is spreading like wildfire.
Yeah, it really is a great concern. Of course, 19th of July is the date set down for schools to go back. How is NATU going to monitor whether your union, your members feel it is safe to do so?
Actually, Sally, we've been monitoring even now, trying to check whether our members are safe. Because the schools, you find that some of the members are being infected at schools, and then we demand that the schools must be closed, and the schools must be fumigated, as well as the learners must go for a checkup. So the date, which is the 19th, we cannot stand on one foot and say we are going to open on that day. It will depend on the rate of infection. If the infection is still high, then we can never say the schools must open. But if the infection is low, then we'll allow teachers as well as the learners to go back to school. That won't harm anyone.
And I would imagine, do you have the same sort of concerns about the plan for, I think it's the last week of July, to go back to full-time learning for primary schools?
Yes, the problem is when we look at the deep rural areas, the schools that are there, you will find that most of the classes are congested. They are having more than 60 learners in each class. And then you are finding that there's no space at all. If the Department of Education can assist by giving the mobile classes where the learner can be divided accordingly, and they can adhere to the COVID-19 protocol as well as the regulation, where they are going to have this social distancing, as well as having water. Some of the tanks are dry. They've placed the tanks since last year, and there's no water. So all the basics are needed so that the learners can go back to school. We only want our teachers to be in their safety environment as well as the learners. Then the teaching and learning can be in a proper way.
Yeah, absolutely. Talk to me about the vaccination process and what your members are saying. Are they generally happy with the process?
Well, Sally, if I may look at the most of our members in all the districts, some of them are happy and some are not, because we are going to find that maybe in some of the districts like Mukanyagute, Ilembe and Durban, those were the districts, yes, those were the districts where the vaccine was depleted, and then the members could not get the vaccine on time. But we waited, and we are still waiting to say, okay, the department is going to pronounce when are they going to proceed with the vaccination. But all in all, the members are happy. Even those that were very skeptical to go and take the vaccine are now going to take the vaccine. And they are happy, and they're being told, even the nurses that are there, they're actually telling them to say, okay, after you have taken the vaccine, you need to take what kind of tablets you need to take in order for you to ease out the pain that you are going to be having. So we are very pleased with all that.
Have any teachers who've been vaccinated or support staff had any adverse reactions, any serious reactions to the vaccine? We know there's a lot of hesitancy, and that's why I just want to open up and just understand what the process has been like for people.
Actually, Sally, we haven't heard of any severe, only about headaches and just the body pains, but not severe impact of the vaccine itself.
And you know, it's so interesting. Teachers, of course, are tasked with giving the right information to children and teaching our children, but they too are not immune from what they see on social media. We had a report last week about some teachers getting quite frightened with all these conspiracy theories and this misinformation about vaccines circulating. Is that something you've had to deal with your members? Is it something you feel that you've managed to sort out?
Yes, Sally, we've managed to sort out, because there are so many myths out there There are so many things that are coming out in the social media to frighten the teachers as well as the non-teaching staff. Some of them are very scared, only to find that sometimes when they go for the vaccine, their blood pressure rises up and then they have to be placed somewhere else so they can take the vaccine. So all those things are frightening the teachers. But we were able to encourage them to go for this vaccine because this vaccine is going to help them to mitigate the impact of the COVID-19. It is very dangerous. So therefore, we are really encouraging them to go for the vaccine.
Having said that, any teacher or support staff who either for health reasons cannot have the vaccine or doesn't want to have the vaccine, are they assured that they're not going to be acted against in any way?
Well, it is said that because of the president of the country did mention that you are not forced to go and take the vaccines, even though there are medias now that are writing or finding in newspaper that there are some myths which are being written there. We don't know whether they're true or not, where they are saying now if you are a teacher and you haven't taken the vaccine, you are going to lose your job. So we don't know anything about that, and we haven't spoken about that with the Department of the Basic Education, but we see in media, in newspapers, there are things that are written in that fashion. So therefore, but the president himself did mention that not everyone, we are not compelled to go and take it. If you feel you want to take the vaccine, you can go. But if you're scared, then, or maybe there are those that are having their own like religious things. So if their religion says they can't go for the vaccine, then they can't go for the vaccine.
Yeah.
So they don't have to be pushed to go for the vaccine.
Absolutely.
But we do encourage teachers to go and take the vaccines because it's very important for them.
Yeah, absolutely. But you're quite right. The president say that no one is going to be forced to take that vaccine. Thank you so much for your time.